How does targeted therapy work for HER2-positive breast cancer? HER2-positive breast cancer is a specific type of breast cancer where the cancer cells have an excess of the human epidermal growth factor receptor 2 protein. This overexpression leads to aggressive growth and survival of cancer cells. Targeted therapy aims to specifically block or interfere with the HER2 protein's function, helping to slow or stop tumor growth. One of the main types of targeted therapy involves monoclonal antibodies. These are specially designed proteins that attach directly to the HER2 receptors on cancer cells. For instance, trastuzumab is a well-known monoclonal antibody that binds to HER2, blocking signals that encourage cancer cell growth. It also marks these cells for destruction by the immune system. Another monoclonal antibody, patritumab, binds to a different part of the HER2 protein. When used together with trastuzumab, they create a powerful dual blockade of HER2 signaling pathways. This combination is often used as a primary treatment for early-stage HER2-positive breast cancer, sometimes alongside chemotherapy. Another exciting approach is antibody-drug conjugates, or ADCs. These combine a monoclonal antibody that targets HER2 with a chemotherapy drug. The antibody acts like a guided missile, delivering the chemotherapy directly to HER2-positive cancer cells while mostly sparing normal cells. Examples of ADCs include trastuzumab emtansine and newer agents like DUS-UT-1201. Additionally, there are tyrosine kinase inhibitors, or TKIs. These are small molecules that enter cancer cells and block the signaling pathways activated by HER2. By inhibiting the tyrosine kinase activity of HER2, TKIs like lapatinib, naratinib, and tucatinib help prevent cancer cell growth and proliferation. Together, these therapies disrupt the HER2-driven signaling that fuels tumor growth. They have been shown to improve survival rates and reduce the risk of cancer recurrence in patients with HER2-positive breast cancer. To determine eligibility for these therapies, doctors typically test the tumor for HER2 status through a biopsy. In early-stage disease, treatment often involves surgery combined with HER2-targeted therapies and chemotherapy. In some cases, trastuzumab and patritumab regimens are used before surgery, achieving high rates of pathological complete response. This means that no detectable cancer remains in tissue samples after treatment. Despite their effectiveness, some patients may develop resistance to these therapies over time. This has led to ongoing research into new drugs and combination strategies to overcome resistance and improve outcomes. In summary, targeted therapy for HER2-positive breast cancer works by specifically identifying and blocking the HER2 protein's role in cancer cell growth. By using monoclonal antibodies, antibody-drug conjugates, and tyrosine kinase inhibitors, these treatments significantly enhance the prognosis for patients. Personalized treatment plans are crafted based on HER2 testing and the stage of the disease, often combining targeted agents with chemotherapy for the best results. Always consult healthcare professionals for personalized medical advice.